Welcome to our number 32 open mic webinar. For this week, I will present an overview of what our chairman of the Medical and Scientific Committee, Dr. Van Nguyen, discussed. This week, he present on the topic of cardiovascular medicine. It's a very important topic, and he'll go over the latest trend and innovation in this space. I want to emphasize that I know you prefer to watch video on my coverage under a particular stock, but in order for you to pick the right stock, a stock that could deliver alpha, it's very important that you understand the underlying science and medicine of the drug that this company are innovating. All that being said, Dr. Van kicked off this week open mic webinar by going over the definition of cardiovascular disease, which, contrary to what you might believe, also include disorder of not only the heart, but also of the blood vessel itself.
As Dr. TRAN pointed out there today, we're going to talk about the emerging trends and investment opportunities in cardiovascular medicine. As you see in the cartoon here, we have the heart pumping, receiving, and pumping blood effectively throughout our body. But, when we talk about cardiology, not only do we want to think about the heart, we also want to think about the whole cardiovascular system. All the blood vessels provide nutrients to our body as well. Definition of cardiovascular medicine, which is a branch of medicine that deals with disorders, the heart and the blood vessel. A lot of times people don't think about the arterial and venous system. They just think about the cardiac system organ only, which should encompass all the heart and the arterial venous blood vessel as well. And this branch of medicine study the diagnosis and treatment of all those conditions and leverage the advancement of science and technology along with pharmacology to improve patients' outcomes.
Next, Dr. Ben highlighted the staggering statistic of this condition is very prevalent in the US. There's 48.6% of Americans are afflicted by one form of cardiovascular disease or another, including a stroke, heart attack, high blood pressure.
Percentage of Americans with cardiovascular disease, as you can see here, almost 50% of us have cardiovascular disease. And the prevalence of heart disease increased with ages. As you can see, up to 25% of adults older than 75 years old have cardiovascular disease.
Dr. Van then shift gear and then went over the treatment modality or the management approach for cardiovascular medicine. The first and also very important is TLC, that is therapeutic lifestyle changes, which include exercise, physical activity, and also dieting.
The way we look at cardiovascular disease, I always advise my patient to first start out with therapeutic lifestyle modification to improve the cardiovascular health. And such things we already, aware, know, we just need to be more mindful and think about, applying to our life, such as eat a balanced diet, stay physically active, maintain a healthy weight, managing stresses, and then attend to regular health screenings through your physician or your providers. Of course, quit tobacco and limit the amount of alcohol you take in. Try to get adequate sleep, stay well hydrated, and limit the amount of processed foods, fast food, and then monitor you and manage your blood pressure effectively.
Next part, which is the more interesting part, the part is more relevant to biotech investment. Dr. Van went over the drugs that are used to treat cardiovascular disease. Some of them include the beta blocker, the diuretics, and also the anticoagulants.
The next class of medications that are also well known, they are called beta blockers. They slow heart rate down, and by doing that, they also reduce blood pressure by decreasing the stress on the cardiovascular system. And some of these medications that you see listed here, the metoprolol, the atenolol, the bisoprolol, the bivalol, and albuterol, those medications also allow us to control the heart rate as well. They have some component of therapy for reducing heart rate in addition to vasodilating effect. And then the most common prescribed medication out there would be the diuretics. And the reason is because they are fairly cheap. So a lot of times physicians will start out prescribing diuretic therapy for high blood pressure, initially with hydrochlorothiazide like we have here. And then if they need something stronger, then they can go to furosemide, bumetanide, or metolazone. The other type of medication you probably hear a lot about, seen a lot of advertised TV, is the anticoagulant, which help prevent blood clot in the heart chamber, in the venous system, and they are warfarin. You probably could also hear of another name, which is warfarin or Gentovan.
Next, Dr. Van went over more promising drugs that are being used to treat cardiovascular disease that are the NOAC or novel oral anticoagulant. There's tremendous advantage for this medicine. You don't have to monitor, or the doc don't have to monitor the INR, that is the ratio which measures the blood thinning. That is a key advantage to this drug.
The new trends of treatment in cardiovascular medicine nowadays is a precision medicine. So we want to tailor treatment based on individual genetics genetic profiles or particular components of our body protein, so allow us to improve the efficacy of therapies for cardiovascular disease.
Dr. Ben also discussed about the use of AI wearable technology, minimally invasive procedure used in cardiology, which are very important.
Wearable technology is also come to play now significantly in our practice. The smartwatch have really made a tremendous change in how we monitor patients. I recommend all my patients consider wearing a smartwatch to allow their cardiac status to be monitored with heart rate and heart rhythm, but now they also have O2 saturation and also allow us to, in the future, monitor blood sugar transcutaneously as well. So I think this has great potential in using to monitor our health system. Artificial intelligence and machine learning make improvement through improved algorithm, how we can predict cardiovascular disease, but also cardiovascular risk and optimize treatment plans for individual patients.
Next, Dr. Ben went over the use of regenerative medicine, that is stem cells, to treat damaged heart condition or heart that has suffered from an MI or heart attack and then the tissue become damaged. Now there are stem cells being developed to treat that condition and deliver stem cells to treat the damaged heart. That could be presented as very interesting investment opportunity.
Regenerative medicine, stem cell therapy, and tissue engineering has been studied for the last 20 years as well. We have some benefit in the stem cell therapy for cardiomyopathy to strengthen the heart muscle. Of course, the regenerative medicine ventures, biotech startup focused on stem cells therapy and tissue engineering. As I mentioned earlier, it's a very complex area, and this really comes down to what cell types to use, and win or lose can be very significant in this type of environment for the stem cells therapy.
If you enjoy our video, make sure you hit the like button, subscribe to our YouTube channel, share it with your friends and your family. Also, just tap, you don't have to smash on the bell notification button so that you can get our video as soon as they are released. Now, the other thing I want to share with you about is that our fund, we have weekly open mic webinar where our leadership team meet, and our chairman of the medical and scientific committee, that is Dr. Van Nguyen. He's a cardiologist, also medical director. And he and our team present on the latest advancement in the life science sector. We cover many niche, many topics, which allow me to gain an advantage in the life science sector. And in knowing so, I can fine-tune my research position and invest in young, innovative companies before they blow up big. Let us capture the tremendous upside in the biotech stock market that will occur in the next few years for you. If you're interested in learning more about our fund, you can check out our website, www.evergrowthinvest.com. You can also reach us by email, info@evergrowthinvest.com, or by phone, 704-957-7746. Reach out to us to see if we are the right fund for you and if you are the right investor for us.